This is a nice demonstration of my first day doing the DEXYCU or dexamethasone injection after the time of cataract surgery. And so the first thing you're going to do is make sure that all of your wounds are completely hydrated and the eye is mildly overinflated at the end of IOL insertion. Then you're going to insert the 25 gauge cannula right to the edge of the haptic in the inside the actual capsule, and you're going to inject just up to the limiting point and then pull out quickly while releasing the tip of the injector at the same time, and that gives you that beautiful little globule of medicine. Here I'm using a 27 gauge cannula technique, so a mildly smaller cannula. We're doing the same thing. We're going to the edge of that IOL, and then we're going to push down on the limiter right till we reach the stop point, release immediately and pull out quickly, and that's what gives us that nice globule of medicine right in the capsular bag over at the edge of the lens. And so this is just another nice demonstration of using the 27 gauge cannula over the 25. And again, I just push down till I reach the end of that limiting. This substance is hydrophobic, so it does want to stick to the cannula. Putting it right near the lens like that attracts the medicine right to the edge of the lens and helps it kind of hold its position. One more demonstration of using the 25 gauge cannula. And here again, all the way into the capsule at the edge of the IOL, you do the injection, let go, and as you let go, you pull out relatively quickly, and that keeps that medicine nice in a peripheral location. And so some of the things that I found with this medicine, using the 25 and or 27 gauge cannula is kind of a gauge of preference more than anything else. I recommend trying both when you're doing this. I find the 25 gauge cannula obviously has a tighter fit because it's a larger gauge cannula. It's a little easier to torque your wound because you don't have as much room to maneuver through that entry point. There's less fluid egress out of the eye though because it's a larger cannula, so it has a tighter fit. The priming of the actual cannula is easier. Again, it's a larger gauge cannula, so the medicine moves out of it a little bit quicker. It's easier to inject, though, a high amount of volume or over injection if you're not using the limiter that they give you at the time when they kind of teach you how to do this. So in the beginning, I was using the limiter. Near the end, I was not. And it is much easier to inject a little more medicine if you're going that way. The 27 gauge cannula, it's easier, obviously, to put it through your para-incision because it's a smaller cannula. It's a little harder to torque the wound because you have a little bit more movement there. But you will notice a mild increase in fluid egress, again, because it's a smaller cannula and there's a little bit more room for fluid to come out of the eye. Priming takes a little bit longer. Again, it's a smaller gauge cannula. The medicine is more viscous, than something simple like a BSS solution. So it takes a little bit more time to allow all that medicine to escape and to prime the injector properly. If you're not using the limiter that they give you at the time of surgery, it's more difficult to release excess medicine, again, just because it's moving more slowly. But the steroid does like to leak through the tip of that cannula until you get it kind of properly primed. Again, these are just a couple of my nice first cases. I'm going to release another video here in the next day or so showing you some of the more trickier insertions and how to handle them. Thank you very much for watching this video.